Hi, Mr. Templeton.
Hello.
My name is Jessica. I'm just a nurse. I'd just like to teach you a little bit about asthma. Is that okay?
Sounds good.
Okay. And so, how long have you been? When were you diagnosed with asthma?
I was diagnosed with asthma at 12.
Okay, so it's been a while. You've definitely been using your inhaler quite a bit. And then, so with the disease portion, a lot of kids, it's more prevalent with kids than it is in adults. However, it can be lifelong as well. And so with the disease process, there's two main components that are part of it. There's a bronchoconstriction portion. So basically it's the muscles in the airway, they constrict and they cause a narrowing of the airway. So it makes it harder to breathe. So with that, you would have like the typical signs and symptoms of you'd have dyspnea, so that's trouble breathing. You might have some wheezing, and then you'd also have coughing. And the coughing portion, that's actually due to the second part of asthma, which is the inflammatory portion. And so with that, you get some edema, which is swelling of those cells in the lungs. And then you'd also get some mucus secretions. And so that's why if you cough, you may be coughing up some sort of mucus possibly when you do have like an asthma episode. And so those are the two main components, the bronchoconstriction, so the contraction of the muscles in the lungs, and the inflammatory portion. And so it just depends on what type of medication you need to use, just based on the severity of the asthma that you do have. So with asthma, some people have more constant narrowing of the airways, so they have to use more long-acting medications to take care of that. But when you do have like an acute episode, you would have to use a short-acting medication. And so in that case, you were prescribed an albuterol inhaler, right?
Correct.
And so in that case, you'd be using that medication just basically to open up that airway. And so, because there's some of the complications of like an asthma attack, if you don't use a medication to open up the airways and help you breathe again, to get rid of those signs that we were talking about earlier, then you can have some hypoxemia, you can start sweating. So basically, your body's just lacking oxygen at that point. And so there are several things that can cause asthma, and it's basically like it's an overreaction by the body. So that's what it seems like to certain triggers. And so there's multiple triggers that we can have. We can have like allergens, air pollutants, food, chemicals. Sometimes a respiratory infection can cause it, as well as stress. So some people have like exercise-induced asthma, so that they would also need to use an inhaler for that as well. And so we've gone over the signs and symptoms. I'm sure you've experienced them just in your time of having asthma since you were a kid. And so as we've discussed, there's those two meds. We have the short-acting medications, and so your albuterol is a short-acting beta agonist. And so it acts on the muscles in the airway, and it basically relaxes them so you don't have that narrowing, and so you can breathe. And so another short-acting medication that they commonly use for asthma attacks would be anticholinergics. So a common one is ipratropium. If you're not prescribed it, you don't have to worry about it, but that is just one of the common ones that are out there. And then systemic corticosteroids. So basically they're trying to decrease that inflammatory response in the cells. And so they're just trying to get rid of that swelling and the edema that's in there. And so for long-acting medications, you have like long-acting beta agonists. So you can also have an albuterol inhaler that's long-acting, so you have to make sure you don't mix those up, because long-acting medications do not work for acute asthma attacks. And so you have long-acting beta agonists, which also work on the muscles in the lungs. So they relax those muscles. You have inhaled corticosteroids. So similar idea, you have the steroids trying to decrease the inflammation. And then you also have medications that directly target immune response. So they're trying to decrease the amount of swelling. They're trying to decrease the amount of reaction basically from those immune cells in your lungs. And so just depending on what kind of asthma you do have, some people that are more chronically sick with asthma, they can use a peak flow meter. You do not have one. Your asthma is relatively well controlled. But with the peak flow meter, you would expire into this peak flow meter just to see how much of you have your normal capacity, how much you can forcibly expire in a short time, and then they would use this peak flow meter to basically rank how their asthma is doing currently and if they need any medication interventions now. And so that's what other people may use for those same two components, just to see if they need to use their medications, how much, all of those kind of things. And so I also just wanted to run through just how we would use your your inhalers. So we have an inhaler here, and this is just typically what you use. And then we also have a spacer. I don't know if you've seen one before, but it's basically just a chamber so that you can have several breaths to breathe in the medication versus having to do it in one. And so with your albuterol inhaler, so when you're planning to take it, you're either going to be sitting up or you're going to be standing. So that way you have adequate chest expansion, and so you can get as much medication into your lungs as you can. And so when you're ready to use your inhaler, you feel short of breath, you feel any coughing or wheeziness, you can hear it, then you would prepare to use your inhaler. And so at that point, you would look at the inhaler first. You would make sure it's the right medication, make sure it's a short-acting albuterol inhaler. We do not use long-acting because those will not help with an acute asthma episode. And so you would look at the inhaler, make sure it's prescribed to you, make sure it has the right dose on it, and make sure it's also not expired. So this you would be using at home. So if you're using this at home, you would then go ahead and shake it, and then you would exhale, and then whenever you would put it in front of your mouth, 1 to 2 inches, with an open mouth, and then whenever you start to inhale, you depress the canister. So as you start to inhale, you depress. And so you take a complete breath in, because it's trying to create a fine mist in front of your mouth so you can breathe that into your lungs. And so once you breathe that in, then you hold that, if possible, for 10 seconds, and then you exhale slowly with pursed lips, which is hard to show with masks on. Versus with this is a spacer, and so you can attach this to the end like that. And so with this, you don't have to take it all in one breath. And you would create a seal around this mouthpiece. And then, so same thing, you would first exhale, you create a seal around the mouthpiece of the spacer, and then when you start inhaling, you depress the canister. And then you do 2 to 3 breaths like that. And so you would then breathe out of your nose, and then take another breath through your mouth of the medication until it's all gone. And so when you're using medication, whether with a spacer or just with an albuterol inhaler, you would be waiting approximately about 1 minute between puffs, and then you would use as many puffs as your doctor prescribes. And so if you would just like to go through the steps, whether you want to use the inhaler or not.
Sure. So with just the inhaler by itself, just verify that it is mine and that it's not expired and that it's my albuterol, the short acting. And then I'm going to shake, correct? And then once I shake, put it to my lips, 1 to 2 inches. And then as I inhale, I want to press down and fully inhale. And then I can exhale after that, correct? Okay, and then if possible, you would try to hold your breath for about 10 seconds if you can. Okay, and then with the spacer, I'm just going to connect right here after I've already shaken it up. Take this cap off. Same thing, 1 to 2 centimeters in my mouth. And
you
then
create a seal around the spacer.
Oh, correct. And then from there, I'm going to inhale and then press down, correct?
Yep.
And then I can. There still should be some leftover.
Well, you're gonna keep on
correct?
Inhaling until there's no medication left in the spacer. Yep.
Okay, perfect. And then inhale until it's completely empty.
Yep.
And then same thing, let that sit for about 10 seconds before I exhale, correct?
Yep.
Okay.
All right. And so just a few questions just to follow up basically what we were going over here. What were those 2 main components of asthma that we were talking about?
So that was, you said bronchoconstriction as well as inflammation?
Yep, those are the 2 mains. And the albuterol is going for the bronchoconstriction. It's trying to relax that airway. And so also, what kind of medication do you use for acute asthma attacks?
The albuterol.
And then is that short acting or long acting?
That's short acting.
Okay, wonderful. Well, I'm glad I was able to share a little bit more information with you. Even though you've had asthma for quite a while, I'm glad I was able to show you the spacer. And I'll hand you your inhaler back.
Thank you.
Thank you for your time.